Thanks for joining us, everyone. We're just going to give it a minute to get started. Thank you.
Hello, everyone. Thank you for joining the 2022 MIPS Overview webinar. During this presentation, CMS subject matter experts will provide information on ways to participate in MIPS in 2022, including MIPS eligibility requirements, participation requirements for traditional MIPS, and requirements for participation in MIPS via the APM Performance Pathway, or APP. This presentation will be followed by a question and answer session where attendees will have an opportunity to ask questions via phone in the Q&A box, and CMS subject matter experts will address as many questions as time allows. You are welcome to submit questions during the presentation or wait to submit your questions until the Q&A portion of the call. Now I will turn it over to Dr. Tiffany Wiggins, Medical Officer at CMS, to begin.
Thank you so much, Emily, and good afternoon, everyone, and good morning still to some of you. My name is Dr. Tiffany Wiggins. I am an OBGYN and a preventive medicine physician leading maternal health and health equity efforts for the Quality Measurement and Value-Based Incentives Group in CMS's Center for Clinical Standards and Quality, or CCSQ. On behalf of our team here at CMS, it is my pleasure today to introduce the 2022 MIPS Overview webinar. In the 2022 Physician Fee Schedule Final Rule, we focus most of our policies around the development and implementation of MIPS value pathways, which don't begin until next year. Today's presentation is instead going to focus on the 2022 performance year. There are a variety of changes affecting traditional MIPS participation and scoring that our subject matter experts will review. As CMS continues to focus on moving the quality payment program forward, the changes for MIPS this year are designed to support more meaningful participation for clinicians and improved outcomes for patients. We are committed to our efforts to move the needle forward on value, and we anticipate that the changes will help clinicians start to see greater returns on their investment in the program. We're also looking for ways to leverage this program to advance health equity and to optimally address the drivers of health that we know contribute significantly to poor outcomes experienced by individuals and families that we serve. In fact, just last week, CMS announced its comprehensive health equity strategy. In it, we articulate our commitment to advancing health equity as a key pillar of CMS's strategic vision and as a core agency function. Within CCSQ, we are focused on continuing to explore equity-focused measurement opportunities across all of our quality programs, including MIPS, as well as other approaches to close gaps in healthcare quality and to realize a system of care that people need to not only survive, but to thrive. And with that in mind, today I am especially eager to share how we are raising the bar to achieve a more resilient, high-value healthcare system that promotes quality, safety, equity, and accessibility for all, and especially for people and communities who are underserved and or disadvantaged by the healthcare system. We recently announced the CMS National Quality Strategy, which takes a person-centered approach and seeks to improve the overall care journey as individuals move across the continuum of care, from home or community-based settings to hospitals and post-acute care. The strategy consists of 8 focused and interrelated goals. 1, embed quality into the care journey. 2, advance health equity. 3, promote safety to achieve 0 preventable harm. 4, foster engagement to improve quality and build trust. 5, strengthen resiliency in the healthcare system. 6, embrace the digital age. 7, incentivize innovation and technology adoption to drive care improvements. And 8, increase quality measurement alignment to promote seamless, and coordinated care. We look forward to further improving upon the quality payment program by aligning with the CMS National Quality Strategy and the goals I've just outlined, and ultimately leveraging the program in pursuit of a high-value healthcare system for all. Thank you, and now I'll pass it over to Katie Moore to begin today's 2022 MIPS overview.
Great, thank you, Dr. Wiggins, and good afternoon, everybody. My name is Katie Moore, and I am a health insurance specialist here in CCSQ as well. And thank you so much, Dr. Wiggins, for highlighting a couple of our different really important strategies that the agency has come out with recently. So our national quality strategy, as well as our health equity strategy. Speaking on behalf of everybody who works on quality payment program, we're really excited to learn more about these different strategies and all of the amazing work I can see it doing over the next several years to address a lot of the different needs that patients that this program interacts with, and improving all of the different areas of their lives that will hopefully drive improvements in their healthcare, but trying to figure out where QPP fits in all of that. So with that, good afternoon, everybody. Thank you for joining us this afternoon. And along those same lines, we really look forward to working with all of you as we, as a program, look to move forward our agency's goals of quality as well as health equity. So more to come throughout this year about all of those different exciting opportunities. Next slide, please. We can go to the next one. Great, thanks. Well, good afternoon, good morning, depending on where folks are throughout the country. We are so excited to be here this afternoon. Myself, as well as we have a number of our subject matter experts on the line today. So you'll hear from some different folks throughout the presentation, and then hopefully we'll have as much time as possible at the end for some Q&A, and hopefully we'll have a good dialogue back and forth. We did make this presentation or time for this webinar a little bit longer, so hopefully we'll have more time for those questions. So today, I know we have a lot of new folks probably on the call that are new to QPP and to MIPS, as well as some folks that hopefully have probably been with the program for many years now. So a lot of the information you're going to hear is probably things you already know, but hopefully it's a good refresher for folks. And we go over a lot of information for our new to MIPS and QPP. So here's just a quick run of show. We are going to go over some MIPS eligibility. We are going to go through traditional MIPS, participation requirements overview. We'll talk briefly about our alternative payment model performance pathway requirements, so APP, and then we'll round it out with some help and support and where to go for more information. So before we get into our slides today, just wanted to level set that this is really our high-level overview of all our merit-based incentive payment system policies for 2022. And there may be a number of questions related to 2021 or future years of the program. And we'll answer those as we can or as they relate to the information we're going to go over today. But we really want to focus on and give folks an opportunity to ask questions and hear information about 2022. So where we are right now, the performance year where we are already in today. So, and we are really excited to get these overview webinars going again. I know we've had a pause on a lot of different things over the last couple of years. So we look forward to having today's webinar, and then just keep an eye out for more to come throughout the year as we dive deeper into our different performance categories and other topic areas. Just a few resources I wanted to flag. I think we talk about these throughout the presentation, or you'll hear different speakers probably reference where to go for more information. So before we get started, I just wanted to call those out. So our QPP website, if you are new to QPP, we have an amazing website. It is qpp.cms.gov. And It has a lot of different resources and information, and it's organized by different performance categories and different parts of the program. And then there are a number of tools, some that we'll highlight here today, that are available on that website. So really encourage folks, that is a great place to get started in this program. We also have a resource library, which is where we keep all of our documents. So all of our fact sheets and user guides and technical information like our measure specifications, everything you need to know about the program is housed there as well. And then we also have our webinar library. So don't worry about trying to write down as much as you can today while folks are talking. I know it's a lot, and we have a lot of information for you today. So please just listen in, and we will always have our recordings of our webinars available in that library, usually a week or so or after different presentations. So you can always go back there and reference things that we've talked about. Usually within 1 to 2 weeks, we have all of our webinars and all of the resources, so the slides, as well as the recordings available. So you can check those out, or if you want to dive deeper into some of our areas that we aren't going to go into too much detail on today, I definitely encourage folks to go there and see what resources are available. And then when you are on the QPP website, I'll probably mention this a few times throughout today, but we have a QPP listserv. So that is our main method of communication with all of our quality payment program stakeholders. So please sign up for that listserv. That is where we send out notifications when we have new resources or things coming up that we want to alert folks to. So please sign up for that. And then we also have, you'll find that at the bottom of the QPP website, I'm pretty sure pretty much every page there's a where to subscribe button, and I believe we just put it in the chat. So please go to that link as well. Thanks. And then we also have, if you are a small practice or a single solo clinician or small practice clinician here today, thank you so much for joining. We also have a target listserv, or if you work with these groups of people, we have a small practices newsletter that is brand new. We put out a couple of issues, but that is a monthly resource as well. So would encourage folks to sign up for that. We have a small practices webpage on our QPP website that you can go there as well. I'm sure we'll put the link in the chat. But if you want to sign up for that monthly small practices newsletter, that is a great resource that is really tailored to our small practices to help support that those groups as much as we can. Okay, I think that is enough reminders and things we have available. So we will move on to the next slide, please. Great. So here's just some information. I know I've seen already some questions coming in through the chat as well about questions just about for 2022. So over the last, just for folks that are new to the program, or over the past couple of years, due to the COVID-19 pandemic, we have issued a number of flexibilities for not only QPP, but across the program, across the agency as well. But for QPP specifically, we have issued some auto policies that have automatically reweighted clinicians to 0% for the past 2 years. So for 2020 and 2021. So I know a number of people have asked in different places if this will be the same for 2022. So just wanted to let people know upfront, at this time, we are not planning to issue an auto policy across the board for COVID-19 for 2022, but we will have, as always, our extreme and uncontrollable circumstances exception application available. So folks can log on to our website and submit this application and request reweighting for one or more performance categories for 2022. And we will have that application available soon, I believe, later in May sometime. So again, that QPP listserv is where we would put out the notification to let folks know that that application is available, and it stays open through the end of the year. So it doesn't close until December 31st at 8 p.m. And when we open that MIPS Extreme and Uncontrollable Circumstances application, we also open the MIPS Promoting Interoperability Performance Category Hardship Exception, which allows you to request reweighting specifically for the Promoting Interoperability Performance Category to 0% if you meet certain criteria. So, and we list out that criteria in the exception applications guide. So if you have issues with internet access and a number of different things, and the EUC application is really for these uncontrollable circumstances. So most people have been associated with it in the last couple of years related to COVID-19. However, in previous years of the program, that application has been used for things such as natural disasters, such as fires or flooding or different things that have happened that have been outside of your control. So please be on the lookout for those applications that will be opening this spring. And then on the screen here, we also have a link to just more information. We have a COVID-19 response fact sheet if you want more information about everything we've done related to COVID as well. But that application will be available. So you will have the opportunity if you are still struggling in your practices with COVID-19 in your communities, we definitely want to have that option available to you. Next slide, please. Okay, this is very high level, familiar to most folks. You see it probably in just about every resource we have for QPP. So this is just a graphic that at a high level tells you how our program is set up. So Medicare Access and Chip Reauthorization Act of 2015, which we refer to as MACRA, it ended the sustainable growth, so SGR formula. So this would have resulted in a very significant cuts to Medicare payments for clinicians. So Congress got together and created MACRA, which created the quality payment program. So how QPP is set up, we have two tracks. So what we're focusing on here today is MIPS. So the left side, so merit-based incentive payment system. So if you're a MIPS eligible clinician, you'll be subject to performance-based payment adjustment through MIPS. And this is based on 4 different performance categories. And don't worry, we have a number of slides that will go into a lot of detail on the different eligibility criteria. So I'm not going to spend too much time right now. And then the second track is our advanced alternative payment models. So if you participate in an APM, and the key thing is here that you achieve qualifying APM participants or QP status, then you'll be eligible for a 5% incentive payment and you'll be excluded from participating in MIPS. And I'm going to go ahead and hop to our next slide, which lays this out a little more clearly. So what we've seen over the past few years is people were confused about this difference between these tracks of the program, because there are still alternative payment model participants that are included in MIPS. So we've created this graphic to hopefully kind of explain in a little more detail how folks get separated out. So there are eligible clinicians, and then the majority of folks are MIPS eligible clinicians. So we'll go through all of the different eligibility criteria in later slides. But how do you know if you are excluded from MIPS because you participate in advanced APM? So if you do not achieve QP or partial QP status, then you participate in MIPS. However, if you achieve partial QP status, then you have the option. You could participate in MIPS if you choose to. And then if you achieve full QP status, then the answer is no, you are excluded from MIPS. So clinicians with QP status are excluded and will earn that 5% APM incentive payment. Next slide, please. Here is, if any folks on the line today are visual learners like myself, it helps to lay things out. And if you're new to QPP, this is a really great place to start to wrap your head around the different pieces of the program on a timeline. So throughout the year. So we that's always a really good place to start when you're trying to figure out what you need to be doing in the program, is always to just kind of look at what performance year we're talking about, and helps keep you grounded in understanding the different requirements or what you need to be doing when. So for 2022 performance year, that's where we are right now. So the performance year began January 1st, 2022, and the performance year ends December 31st, so the calendar year. So this is where you are, what you're doing right now, you're taking care of your patients and keeping all of the different data that you need to submit to CMS next year. So after 2022 ends and the performance year is done, then our data submission period opens. So in 2023, so January 2023 is when data submission opens, and then it is open until March 31st, 2023. So this is where clinicians are submitting, and their third-party intermediaries that you're working with submit data to CMS. And then we always encourage folks to submit data as early as possible to CMS. So after you've submitted that data, then CMS gives you feedback. So after that, right after data submission closes, you're going to get some real-time feedback, and then you have some more final feedback that comes a little bit later. So we provide performance feedback right after the data is submitted. Clinicians receive feedback before the start of the payment year. So you'll get additional feedback later that gives you your payment adjustment as well, or your final score as well as your payment adjustment. And then beginning in 2024 is when that MIPS payment adjustment takes effect based on how you performed in 2022 and based on what data was submitted in 2023. Next slide, please. So traditional MIPS, you will start hearing this term as well, and we'll explain that a little more when we mention our MIPS value pathways, which is a new way to participate in the program that begins in 2023. But for traditional MIPS, which is the program as we've known it to date, there are 4 performance categories that I mentioned earlier. We have quality, cost, improvement activities, promoting interoperability. So each of those performance categories has a specific performance category weight. So for 2022, MIPS quality is 30% of your final score. Cost is 30%. Improvement activities is 15%. Promoting interoperability is 25%. So a total of 100% that gives you your final score, which leads to your payment adjustment. We have some more detailed slides later that go into how that final score leads to a payment adjustment. And then also here we have for traditional MIPS, our APM entity participation. Quality is 55%, cost is 0, improvement activities is 15%, and promoting interoperability is 30%. Next slide. Okay, and here is just a very little bit about MVPs. So if you are new to the program and have never heard of MVPs, this is our merit-based incentive payment system. So MIPS value pathways. This is going to be a new way to participate in the program beginning with 2023. So we have these are the MVPs that are currently be available in 2023. So for rheumatology, stroke care and prevention, heart disease, chronic disease management, emergency medicine, lower extremity joint repair, and anesthesia. And we will continue adding new MVPs to the program throughout the years through our rulemaking cycles. But what, in a very high level nutshell, what MVPs are is they are a really more meaningful way for clinicians to participate in the program that are a subset of measures and activities that really make sense for how the clinician practices in the program. And if you want more details about MVPs, we have an entire webpage dedicated specifically to MVPs that lists all of the information you would need to know about MVPs. And we've had a number of MVP specific webinars. So please check out that MVP or that MIPS, I'm sorry, QPP webinar library for all things about MVP, to go into more details on what these are, how to get involved if you're thinking about participating through MVPs, and what this means for the future of QPP. Next slide. We can go to the next one. Thanks. Okay, so here is a little bit more of that detail I was leading to in the beginning. So how do we determine MIPS eligibility? So first we start by identifying if you're a MIPS eligible clinician. So we have a list of all these different clinician types that have been involved in the program for years. And we are really excited. So for 2022, big thing I want to highlight is that we've added a couple of new clinician types. So clinical social workers and certified nurse midwives are now also included as MIPS eligible clinicians. And I know we've had a lot of back and forth with these groups over the years. So we're really excited for you to join us in this program. And I hope a number of you are on the line today. So that's step one. Then we take a look at if you exceed all three elements of our low volume threshold criteria during a specific determination period. So we have a slide shortly after this that will go into detail on what exactly our low volume threshold criteria is. Then we confirm if you were enrolled as a Medicare provider before January 1st, 2022. So if you've just enrolled, you get a year to figure out the program. And then if you exceed these different other criteria, then you'll get added in next year. Next, we confirm if you are not a QP or a partial QP. Again, as we mentioned before, those would be some exclusions out of MIPS. So then if you meet these criteria, you are required to participate in MIPS. Next slide. So again, same information here, just basics to know if you need to participate in this program. So we exclude newly enrolled in Medicare clinicians if you are below the low volume threshold, and if you have that significant participation at the QP or partial QP level as an advanced APM, then you are excluded from MIPS. Next slide. Okay, this is where we lay out our low volume threshold criteria. So there are no changes for 2022. So what you're seeing on the screen is exactly what the low volume threshold was for 2021, and I believe a couple years before that. It's been a little while since we've adjusted this. So hopefully that consistency has been helpful for folks. So there are three parts to our low volume threshold criteria. So the first part, if you bill more than $90,000 a year in allowed charges for covered professional services, and you see more than 200 Medicare Part B beneficiaries, and you provide more than 200 covered professional services to Part B patients, then you are included in MIPS. You are required to participate through MIPS. So that's the key information here I want folks to take away. You must exceed all three of these different criteria. And I think we go into a little bit more next on, what if I only exceed one? What if I don't exceed any? So if you don't exceed any of them, you are not required to participate in MIPS for 2022. Next slide. Okay, so this is our MIPS determination period for 2022. So we look at your Medicare claims from two different 12-month segments that are aligned to the fiscal year. So we took a look at, so for 2022, if you go in right now and go to our QPP website, we have a lookup tool, and I know we have a slide that'll show you how to get there in a little bit, but you could see right now, am I eligible for the program? Do I need to participate? What do I do here? So we take a look at our historical data. So from October 1st, so these Medicare claims from October 1st, 2020 through September 30th, 2021. And that gathers a lot of that information that we need for those different criteria. So that determines your initial eligibility in MIPS. And if you're excluded during this initial run, you will maintain the status for the entire performance period. October 1st through 2021, and then September 30th through 2022 is our second MIPS determination period, and it includes data from the performance period. So these are two different time periods that we look at when we're figuring out who's eligible for the program and who's required to participate and who is not. Next slide, please. So how does this low volume threshold apply to groups? So CMS, so at the same time, and I should have mentioned this, that is when we are looking at all of that information previously based on your as an individual. So how does that apply to you if you participate in a group? So at the same time, we look at, during that determination period, we look to see if your group contains at least one MIPS eligible clinician type. And then collectively as a whole within your group, do you exceed that low volume threshold? And then if your group has if your group has at least that one MIPS eligible clinician and you exceed all three criteria, your group is eligible to participate in MIPS. I do want to make sure you do not have to report as a group in MIPS. The only folks that will be required to participate as a group are those that have elected to participate as a virtual group. And there's more information on the whole registration process that we have for that. But group participation is optional. So if you are excluded from MIPS as an individual, but eligible to participate as a group, you aren't required to do so. So you only need to be included in MIPS if your group chooses to participate. And I know we've had some scenarios before where folks, you aren't sure if your group's participating or not. So that is definitely something you want to ask other members of your group, or just so that you know what's happening with your claims. So if your group doesn't exceed all three of these, your group is, as we said, excluded from MIPS, and you don't need to submit any data to CMS. Next slide. Don't worry if you are excluded from MIPS, but you really want to participate. We have a couple of different options. So there is voluntary participation. So this is for folks that didn't meet those different criteria that we laid out, but you still want to submit data to CMS and receive feedback. So voluntary participation is a great option, especially for newer folks. If you want to just get that feedback from CMS and see how you might do in the program when you're required to participate in future years, potentially. So the important thing here is that you will receive feedback from CMS, but you will not receive a payment adjustment associated with that scoring. So if you want to, our second option is the ability to opt in. So individual clinicians are eligible to opt into MIPS if you are identified as a MIPS eligible clinician type on Medicare Part B claims, if you have enrolled in Medicare provider before 2022, and you aren't a QP or partial QP. So if you exceed at least one of those three low volume threshold criteria, you are eligible to opt in. And a practice is eligible to opt into MIPS if you have at least one clinician who is MIPS eligible, enrolled as a Medicare provider prior to 2022, and again, not a QP or partial QP. Important thing to note here is that if you do opt in to MIPS because you exceed at least one of these low volume threshold criteria and you want to participate, you will receive that CMS feedback on what you've submitted. And you will also, the important thing here, that's the difference between voluntary, if you opt in, you will receive a MIPS payment adjustment based on whatever data you provide to CMS or is collected. So we have an additional information. If this type of opt-in process is of interest to you, we encourage you to check out some additional resources we have on the resource library and the process for doing all of that. Next slide. real quick, this is just this QPP participation status tool that I was mentioning. So it is front and center on our QPP website. So it is right at the top to get to there. And all you do is type in your NPI, so your National Provider Identifier, and it will give you your initial eligibility on what your status is with QPP. So that is a great place for folks to start. And then again, we have some resources here that we also encourage folks to check out right away. So our 2022 MIPS Quick Start Guide, and then also we have a more detailed MIPS eligibility and participation user guide available. Next slide. We get this question a lot. So what happens if I'm associated with multiple practices in the QPP status tool? So what are you going to see? So if you reassign your billing rights to multiple TINs, which is very common, you'll see associations to multiple practices on the QPP participation status tool, which we refer to as the lookup tool. So we evaluate your MIPS eligibility at each of those different practices. So your TIN and NPI combination is really what we look for when we're pulling all of our different data. So you'll receive a payment adjustment based on the TIN and NPI combinations where your low volume threshold was exceeded as an individual or as a group, if your group chooses to participate in that way. So you won't receive a payment adjustment at any of the practices that you're associated with where you didn't exceed that low volume threshold or where there's some other criteria where you were excluded from MIPS. Next slide. And one more. Okay, so here's just a quick graphic on the different participation options for MIPS eligible clinicians. So you can report as a group, I'll start with individual. As an individual, so that is one option. So under your NPI, your tax identification number, so your TIN NPI combination there, and then as a group, so that is 2 or more clinicians who have reassigned their billing rights to a single TIN. So you can participate as a group. And then our third option, which I mentioned briefly, is our virtual group. So this is made up of solo practitioners and groups of 10 or fewer eligible clinicians who come together, as it says, virtually. So it doesn't matter what specialty or where you're located throughout the country. If you want to bring your different practices together to participate in MIPS for a performance period, you have that option. And we have a lot more information about the virtual group election process, because you do have to let us know prior to data submission if you are, or prior to a given year, if you are going to participate as a virtual group. And there is a whole guide on virtual groups if that is something of interest to you. Next slide, please. So traditional MIPS, so collection, submission, and submitter types. And this is just gives you some options on if you're reporting as an individual, how do what options do you have available to you to submit data to CMS for the different performance categories. So I won't waste, I know we're moving along here, so I don't want to go through every little detail on this slide, but just gives you a quick look at some different options for the different performance categories. Next slide. And then same thing here, we just have some different options that are laid out for our groups, virtual groups, and APM entities based on your different submitter types and submission types. And these are some keywords that we use. So when we say submission type, it's how you're submitting data to us, so the different methods. And then submitter type is who is submitting, and then what it is you're collecting. Is it ECQMs or is it CQMs, and different measures. Next slide. And I am going to turn it over to my colleague, Lisa Marie Gomez, to go over our CMS web interface transition.
Thanks, Katie. So as Katie noted, oh, can you go back to the previous slide? So as Katie noted that there are various collection types in which data is reported to CMS. So the web interface, the CMS web interface is one way in which groups, virtual groups, and APM entities can participate in MIPS, specifically reporting data for the quality performance category. So for calendar year or for 2022, that is the last performance year in which the CMS web interface will be available for, or actually under traditional MIPS. So again, that would be for groups, virtual groups, and APM entities participating under traditional MIPS. So in the calendar year 2022 physician fee schedule final rule, we sunset the CMS web interface. So starting with the 2023 performance period, groups, virtual groups, and APM entities who are participating under traditional MIPS will need to use an alternative option for collecting and submitting data for the quality performance category. And I want to note that the sunset policy for the web interface does not affect the 2022 performance period. So as I noted, again, the 22 performance period is the last year in which you're able to participate in traditional MIPS using the CMS web interface. So once the 2022 performance period is done, as he noted, data submission will start at the beginning of 2023. So that relates to, again, traditional MIPS for groups and virtual groups and APN entities. Next slide, please. Now I'm going to turn it back to Katie.
Great, thanks, Lisa Marie. Okay, just a few more quick basic slides, and then we're going to jump into some more details on our specific performance categories. So basics for 2022. So we have, as we mentioned before, we have these. We have a performance threshold. So this is the minimum final score you need to avoid a negative payment adjustment or to earn a neutral payment adjustment. So this is what you're trying to reach. So for 2022, our performance threshold is set at 75 points. Additional performance threshold or our exceptional performance is set at 89 points. And we'll compare your final score to that performance threshold and exceptional threshold. And that's how we determine your payment adjustment. And important flag here to note is that 2022, so the current performance year that we're in that's associated with the 2024 payment year, this is the final year that additional adjustment, so additional money available for that exceptional performance will be available. And in very fine print here, just so folks can make sure aware of this. So your payment adjustments are multiplied by a scaling factor, which gives us that budget neutrality. So, and I should have mentioned this at the start, the program is, so QPP is a budget neutral program, which at a high level just means our number of positive payment adjustments are, or how many people can get those positive, the amount of money that's available for positive payment adjustments is based on the number of negative payment adjustments as well. So the balance has to be neutral. Next slide, please. And here just lays out some more detailed information about our payment adjustments and how final scores relate to those payment adjustments. And this has been an incremental increase. So since the program began in 2017, we really kept that performance threshold low just to get people started in the program. It was a big transition from our legacy programs and really wanted to get people started on the right foot. And then over the years, we've increased it slightly. And then, so for 2022, this year is when we have a statutory requirement that our performance threshold must be based on the mean or median of final scores from a previous year. So 75% is, or 75 points is where our performance threshold is for 2022. So again, here it just lays out, depending on how many points you achieve, what that equals out to as far as payment adjustment whether you receive a negative, neutral, or a positive payment adjustment, or exceptional through that higher points earned. Next slide, please. And then real quick, this is just how our performance periods for each of the different performance categories is set up. So it's the length of time that you or your group is required to report on data. So quality and cost are 12 months, and cost, CMS collects that on your behalf. So there's nothing you need to submit to CMS for that. Quality is 12 months. And then improvement activities are 90 days depending on the activity. So when you're selecting your improvement activities, there'll be more information on how long you need to participate in that activity to achieve full points. And then promoting interoperability is 90 days as well. And then in order to achieve your highest MIPS final score, you should report data for, as it says here, the minimum period under each performance category. Next slide. And again, this just shows the different performance category weights over the years and how we've had this incremental increase from over the past few years. So just laying out how they've changed over from 2020 to 2021, and then again where we are right now in 2022. Next slide. Okay, and with that, I'm going to turn it back over to Lisa Marie Gomez to go through our quality performance category.
Great, thanks, Katie. So I'm going to go over and provide a general overview of the quality performance category requirements and just elements pertaining to it. So for 2022, the weight for the quality performance category is 30% of your MIPS final score. So the quality performance category will be weighted at 55% for MIPS eligible clinicians participating as an APM entity. So as Katie noted, the performance period or the reporting period for the quality performance category is 12 months, so the full calendar year. For the quality performance category, we have a total of 200 quality measures. So our inventory for the 2022 performance period has 200 quality measures. So as a group, as an individual or a group, a virtual group, or APM entity participating in traditional MIPS, you have the option of selecting over, from 200 measures. And to participate in the program, you're required to select at least a minimum of 6 individual measures. One of those measures must be an outcome measure or a high priority measure if an outcome measure is not available. So a high priority measure falls within these various categories. So one of the categories is an outcome, patient experience, patient safety, efficiency, appropriate use, care coordination, and opiate related. So if, let's say, there are 6 measures that apply to you or your group or your virtual group, you should report on as many applicable measures. You may also select a specialty-specific set of measures within the program. So these include specialty sets that include fewer than 6 measures. Or for 2022, as we noted, the other option to participate in MIPS is to report on all 10 web interface measures. And again, I just want to highlight that for the 2022 performance period, the web interface, that is the last year in which it will be available. Next slide, please. So for 2022, we included in our policy, in our final rule, scoring updates. So we implemented several changes to the quality performance category, specifically relating to the following scoring elements. So for a new measure that is implemented for the first time in MIPS, there will be a 7-point floor. And for that same new measure that's being implemented, and let's say it's in the second year in the program, there will be a 5-point floor. We will continue to apply the following performance category scoring policies. that were established previously from the 2021 performance year. So measures that meet case minimum and data completeness requirements and have a benchmark will receive 3 to 10 points. Measures without a benchmark or historically or performance period benchmarks will earn 3 points. Measures that don't meet case minimum, so for example, 20 cases, will earn 3 points. I just want to note that the case minimum policy only applies to quality measures submitted by clinicians. So measures calculated for administrative claims measures are excluded from scoring if the case minimum isn't met. Next slide, please. Now I'm going to go over achievement points for 2022 performance period. So measures can earn between 0 and 10 achievement points based on performance in comparison to a benchmark and the volume of data reported. So now I'm going to discuss bonus points. So we will continue bonus points for small practices, and they will, in which it's specific to adding 6 bonus points to the quality performance category as long as one quality measure is submitted. I want to note that starting with the 2022 performance period, there will no longer be bonus points specific to reporting an additional outcome or high priority measure, which is beyond the one that is required, and we're no longer applying bonus points for the end-to-end, for the electronic end-to-end reporting. Next slide, please. I'm going to go over data completeness for the 2022 performance period for the quality performance category. So we will check to see if you or your group have submitted performance data on a minimum percentage of your patients that meet a quality measures denominator criteria. For 2022, the threshold for the data completeness is 70%. So 70% for data submitted on QCDR measures, MIPS EQMs, and ECQMs, and this is all relating to all payer data. It's also 70% for data submitted on Medicare Part B claim measures. So with regard to the web interface, the data completeness pertains to the first 248 Medicare patients assigned to each measure within the CMS web interface. Measures that don't meet the data completeness criteria earn 0 points. So small practices receive 3 points for measures that do not meet data completeness. Next slide, please. So now I'm going to highlight elements relating to changes that we made in the 2022 Physician Fee Schedule Final Rule relating to our inventory of quality measures. So within our inventory, we made substantive changes to 87 existing MIPS quality measures. We also made changes to specialty sets. We also removed measures from specific specialty sets, and we removed 13 quality measures. We also added 4 quality measures, including 1 new administrative claims measure. Next slide, please. Now I'm going to turn the presentation over to my colleagues, Ray and Dante, to discuss the cost performance category requirements.
Thanks, Lisa Marie, and hello, everyone. My name is Ray Desatil, and I'm the cost measure lead here at CMS. We can go to the next slide, please. So for 2022, the cost performance category will account for 30% of your MIPS final score. As mentioned before, APM entities will have a cost measure weight of 0% for 2022. Similar to the quality performance category, the cost performance category is a 12-month reporting period, and there is no reporting requirement for the cost performance category. CMS retrieves all cost data from your administrative claims. And there will be 5 new episode-based cost measures for 2022. There are 2 procedural measures, melanoma resection and colon and rectal resection, 1 acute inpatient measure for sepsis, and 2 chronic condition measures, diabetes and asthma COPD. And finally, in order to be scored on a cost measure, you or your group must have enough attributed cases to meet or exceed the case minimum for a cost measure. Next slide, please. And there are 25 total cost measures for the 2022 performance period. This includes the Medicare spending per beneficiary, MSPB clinician measure, the total per capita cost, TPCC measure, as well as 23 episode-based cost measures, 5 of which are new. And measures can earn between 1 and 10 achievement points based on performance in comparison to the benchmark. The next slide, please. And finally, currently CMS and our measure development contractor develop all cost measures. For 2022, in addition to our current process, CMS will establish a process for cost measure development by stakeholders, and that includes a call for cost measures beginning this year in calendar year 2022 for earliest adoption into the MIPS program by the 2024 performance period. And I believe that's my last slide, so I will now pass it over to my colleague, Michelle Peterman, to go over improvement activities.
Thank you, Ray. Hello, everyone. My name is Michelle Peterman, and I will be walking us through a few key traditional MIPS improvement activities policy updates for 2022. Next slide, please. First, for a bit of background, the reporting basics for improvement activities have not changed for 2022. The improvement activities performance categories were 15% of the MIPS final score. The performance period is a consecutive 90-day reporting period. A clinician may gain a maximum score of 40 points, which may consist of medium, which are worth 10 points, or high, 20 points weighted activities, and it can be in any combination to reach the 40 points. In order to receive credit for completion of an activity, a clinician would need to attest to the activity during the data submission period. We do request that clinicians maintain their supporting documentation for activities attested to for at least 6 years in case of an audit. I would also like to note that our flexibilities for reduced reporting requirements continue for special statuses. Special status includes clinicians that are in small practices, those in rural locations, or in health professional shortage areas. If one of those designations applies, then a medium weighted activity would be worth 20 points and the high weighted would be worth 40. So clinicians with special status would only need to complete 1 high or 2 medium weighted activities to achieve the 40 points for the improvement activities performance category. Next slide, please. So for 2022, we did make a few changes to our inventory. We added 7 new improvement activities. 3 of those are related to promoting health equity. We modified 15 of our current improvement activities, 11 of those which address health equity. And then we removed 6 previously adopted improvement activities. These were incorporated into the modification, so we combined them. For specific details on these changes, please go to the QPP website under Explore Measures and Activities. You can search for a specific activity or review the Excel file. It contains the 2022 IA inventory with all of the changes noted. Next slide, please. So one of our first policy changes we made for 2022 was the removal of an IA during the performance period. We previously didn't have a policy to address removing IAs during the performance period. This issue came to our attention when we found out that an IA had become obsolete after the proposed rule had been published. Since IAs must be removed through rulemaking, this left us with no way to immediately remove the obsolete IA. So we needed a way to remove those without waiting till the next year's rulemaking. Otherwise, they would have had to stay in the program another year and not be available for completion. So in order to allow us the flexibility to suspend the IA during the performance period, we finalized a policy that allowed us to suspend them if they pose either a safety concern or if it becomes obsolete during the performance period. If this issue was to arise, we would alert stakeholders. It's expected to be very rare. It's only happened this one time that I'm aware of in the history of the program. So, but if it was to arise, we would alert stakeholders through listservs, and then we would subsequently remove it from the QPP website, and it would not be available for attestation for that year. However, if the clinician had already completed the IA during the performance period, we would allow them to submit that attestation because it is possible that the IA could have been done within the 90-day period or a shortened period. Next slide, please. So our second policy relates to our criteria for nominating an activity through our call for activities. Just to put a note out there, if you're interested in submitting a nomination for a new activity or a modification of an existing activity, The annual call for activities is open currently and will be open from now through July 1st. So please feel free to pursue that and submit activities. So what the new policy is that we only required one criteria to be met in order to submit a nomination through the call. So we felt that was a very low bar requirement. And since we've had several years of experience in the program now, we wanted to increase our criteria. So we added actually 2 new criteria, which are the first 2 there. The first one does not duplicate other improvement activities in the inventory. I think that one's pretty self-explanatory. And then the second one was that it should drive improvements that go beyond purely common clinical practices. And what we mean by common clinical practices are things that are typically done in a practice that aren't anything different. Things like taking a patient's vital signs, something to that effect. So those 2 we added, and then we are now requiring those 2 plus 6 of our older criteria that we had that were optional. So now we are going to be requiring these 8 criteria that you see listed here on the list. Next slide, please. Okay, I guess that wraps me up. So I'll pass it over to my colleague, Elizabeth Allen.
Thank you, Michelle. I'm going to talk about the promoting interoperability performance category, the 4th of the 4 performance categories. So just as a reminder, it's worth 25% of your MIPS final score. You can choose any continuous 90 days or up to a full year. It just has to be a minimum of 90 continuous days as your performance period. We do performance-based scoring at the individual measure level, although some measures are yes, no. And for 2022, you either need to have 2015 edition certified EHR technology, 2015 edition Cures update certified EHR technology, or a combination of the 2. Starting in 2023, we will be requiring the 2015 edition Cures update. In addition, we have 4 scored objectives. Next slide, please. So now we're going to talk about what's new for 2022. So clinical social workers, as Katie had mentioned, clinical social workers and certified nurse midwives are now MIPS eligible clinicians. So clinical social workers had no experience with using certified EHR technology, so we are automatically reweighting them for 2022. Certified nurse midwives were participants in the EHR incentive program, our predecessor program, and so they are not being reweighted. In addition, we used to have a hardship exception that small practices could file for and get their promoting interoperability score reweighted. Starting in 2022, we're going to do that reweighting automatically. So no worries if you want to submit data. If you do submit data, the reweighting will be canceled and your data will be scored. Okay, we also added a new measure. It's the High Priority Practices Guide of the Safety Assurance Factors for EHR Resilience Guides. This attestation is a yes, no, and either a yes or a no would fulfill this measure for 2022. We also revised the prevention of information blocking attestation statements. And now they're called the actions to limit or restrict interoperability. We revised our public health and clinical data objective. It used to be that you had a choice of any, you would submit to 2 registries from a choice of 5 different types. Now, starting in 2022, you must submit for immunization registry reporting and electronic case reporting. And this is really based on the importance of having public health data during a pandemic. We did not get rid of the 3 remaining measures, the public health, the clinical data registry, or the syndromic surveillance reporting. If you submit one of those, you will get 5 bonus points. If you submit more than one of those, you'll still only get 5 bonus points. Next slide, please. So as we have in previous years, we have promoting interoperability performance category hardship exceptions. You need to file these for these exceptions when the submission period is open, and we have them available for different purposes. And I will note that under the extreme and uncontrollable circumstances, that's where you would apply for that if there's issues with your vendor. If your application is approved, you will be reweighted, but if you submit data, it will be scored and you will have your hardship canceled. Next slide, please. Okay, so we do a lot of reweighting for the promoting interoperability performance category. It may be because you're a special status, such as an ASC-based or hospital-based clinician. It could be your type, as I mentioned, the clinical social workers, but we do reweight other types as well. Again, as I mentioned, automatic reweighting is now available for small practices. And if you're in a group, you can apply for these hardship exceptions as a group, as long as everybody in the group qualifies. We have some resources here. Next slide. Okay, so just as a review, these are the scored measures. E-prescribing is a numerator and denominator measure. That's why the points range from 1 to 10 points. Query of PDMP is a bonus measure. If you submit it, you would submit a yes, you would get 10 bonus points. You have options for health information exchange. You can either do option 1, which is the 2 support electronic referral loops measures, or you can do the health information exchange by directional exchange measure. Patients electronic access to their health information, and as I just mentioned, the 2 immunization registry measures. Okay, so that concludes the traditional MIPS, and I'm going to turn it over to Katie Moore.
Great, thanks, Elizabeth. All right, next slide, please. We're going to try and just go through the last of these pretty quickly here, just so we can get to some time for questions. So this is just a quick checklist for folks. We've found that this is helpful for people when they're trying to figure out what the heck to do to get started. So first step, as we've mentioned, please check out the Quality Payment Program website and the tools that are available there. The QPP participation status lookup tool that'll give you some initial and eligibility information that you need. Our Explore Measures and Activities helps you figure out of all these measures and activities, what do I pick? What do they mean? What are the different information related to them? And then our QPP resource and webinar libraries. And then if you're included or intend to opt in, so determining whether you want to participate as an individual or as a group is really important right now. And then identifying the measures and activities that you want to report when we get to data submission at the beginning of 2023. So as I know Lisa Marie went through in greater detail, quality performance category does have that 12-month data collection timeframe, so please be mindful of that. And then if you have any questions, as always, there is our QPP Service Center available to answer questions. Next slide. And then here are just some links to things that we mentioned at the beginning, our website, our tools, and then the different libraries, as well as our help and support page that'll get you to our QPP Service Center, and then our small practices newsletter. And then again, sign up for our QPP listserv to be the first to hear about all things Quality Payment Program. Next slide. Okay, I'm going to turn it over to Brittany LaCouture to talk through some APP requirements.
Thanks, Katie. Next slide, please. So by way of quick background, the APP, the APM performance pathway, is similar to the MVPs in that it is a scoring pathway that is designed for a specific type of MIPS eligible clinician. In this case, we're talking about participants in APMs. For most of our participants, the APP is totally optional. However, shared savings program ACOs are required to report on the quality measures of the APP for purposes of the shared savings program. So just want to keep that in mind. But going forward, I'll just continue talking about it as a voluntary participation because for purposes of MIPS, it is voluntary. It is designed to reduce reporting burden for our participants by creating scoring opportunities in MIPS, such as having the cost performance category reweighted and the automatic assignment of a score for the improvement activities performance category. And we do have some slightly different performance category weights under the APP. For quality, the weight is 50%. For IA, it is 20%. And for promoting interoperability, it'll be 30%. Again, under the APP, the cost performance category has been waived, so it's set at 0%. And again, anyone reporting the APP will automatically receive a full score for the IA performance category. So no additional reporting needs to be done there. Next slide. So under the APP, if you are in the shared savings program, you're a shared savings program ACO, you have two options for how you can report quality to the APP. The first is that you can use a CMS web interface through Performance Year 2024. And by using the web interface, you would have to report the measures in the 10 measures in the web interface, in addition to the CAPS for MIPS survey and the 2 administrative claim measures that are applicable to everyone under the APP. And that's the multiple chronic conditions measure and the hospital-wide readmission measure. The second option for shared savings program ACOs, which is the only option for everyone else, is that you would be required to report on those 2 administrative claims measures, the CAPS for MIPS survey, and there are 3 ECQM or MIPS CQMs that you would be scored on. Or if you're part of a small practice or a small APM entity, Medicare Part B claims measures are an acceptable means of reporting on these ECQMs. And actually, let's go to the next slide. I'm gonna get ahead of myself. Oh, right. So we already briefly talked about this, but this is a great visualization of the performance categories under the APP. Again, I'm going to point out that cost is weighted to 0%, and that is regardless of how you participate in MIPS, or sorry, of how you report the APP. So whether it's an individual, a group, or an APM entity, cost is reweighted under the APP. Next slide. And I guess that's it for me. Next slide.
Thanks, Brittany.
Thanks, Katie.
Yep. All right. Well, we are wrapping up. So again, just we're going to try and get to as many questions as we can. I know you guys have been adding them to the QA, so thank you so much. We're trying to sort through everything and get to as many as we can. But if we don't get to your question, please reach out to the Quality Payment Program Service Center. We have some amazing agents there that know so much about this program and can help work through either basic questions or more complex specific situations. So please encourage you to reach out to them if you need additional help after today. And then I believe we can go to the next slide. I think I'm turning it back over to our Ketchum team on the phone to walk us through how our QA session is going to go.
Thanks, Katie. We're now going to start the Q&A portion of this webinar. You can ask questions via the Q&A box or through the webinar audio. So to ask a question live via the webinar audio, you'll need to raise your hand and we will unmute your line so that you're able to speak. So we'll give folks just a minute to start raising their hands in case there are any questions they would like to ask live, and we can get started with some of the questions that have come in through our Q&A box. So the first question that we would like to respond to that's come in through our Q&A boxes: are there plans to sunset traditional MIPS reporting and require subgroup and MVP participation?
Yeah, thanks, Emily. This is Sophia Sukumar from CMS. I'm happy to take that question. So we have indicated through the calendar year 2022 final rule our intentions. We did not necessarily finalize any proposals of sunsetting the traditional MIPS program, but we have signaled through the rule that we do have intentions through future rulemaking to sunset traditional MIPS. And of course, that will be timed in a manner that considers us implementing MVPs that are widely available to all specialties that participate in our program. So we do anticipate that will take a few years, but we have signaled that direction within the calendar year 2022 final rule. It was not a formal proposal. We don't have a definitive date for that signal or that sunset, but more to come on that in the next few years. Thank you.
Great, thanks so much for that response. We'll go to another question from our Q&A box, and this question asks, will there be an extreme and uncontrollable circumstances exception for COVID-19 this year, and will it be automatic like in previous years?
Great, thanks, Emily. Thanks for the question. So just to clarify, this is Katie again, everybody. So as we mentioned at the beginning of the presentation, let me just clarify. So we have two extreme and uncontrollable circumstances. There's an automatic policy, and then there's an application-based policy. So the automatic policy is the one that clinicians don't have to do anything. CMS says we are applying our automatic EUC policy based on whatever the extreme event is, and clinicians that it applies to automatically have all of their performance categories reweighted to 0%. And this is at the individual level. So this does not apply to groups. So this is our auto policy. So we, at this time, we are not planning to apply our auto MIPS EUC policy across the board for 2020. As of right now, that is not what we're planning to do, but we are planning to have our MIPS EUC application available for those that are still being impacted significantly by COVID-19. So our application will be available again later this spring in sometime in May, I believe. So be on the lookout for that. And then just to say again, the auto policy applies to individuals. And I know we had some questions about non-COVID related. And right now we do not have any event triggering our auto EUC policy for 2022. So it has not been applied or is not being applied currently. Typically, we follow if an area has been declared by FEMA as a national disaster area. We typically follow that policy that it. But we'll have more information on our resource library and our automatic EUC fact sheet for 2022 that will be available soon. And then again, our QPP listserv is where whenever we do apply that auto policy to a specific area because of a national disaster or natural disaster or something to that effect, we do send out an alert on our resource, our QPP listserv. So please sign up for that. But I hope that clarifies any EUC policy questions.
Great, thank you so much, Katie, for that clarification. We're now going to go to our phone line so that we can take some questions live from folks who have their hands raised. So the first person that we're going to call on is Debbie Burberry. We're going to go ahead and unmute you so that you're able to speak. And you may be double muted, so you may have to unmute on your end as well. We may be experiencing some technical difficulties, so we will give you a moment to connect and we can go to the next person with their hands raised. So Trudy Piercy, we're going to go ahead and unmute your line so that you're able to ask your question. And we may be experiencing some technical difficulties with the phone line. So we're going to go ahead and move back to some questions that have come in through our Q&A box, but we will try to get back to the phone line and answer as many questions as time will allow. So our next question that has come in through the Q&A box is about MVPs. And this question asks, what if none of the MVP programs apply to our practice?
Yeah, thanks, Emily. So for that scenario, we are aware that we don't currently have enough MVPs available for all of the participating specialties in our program. It is something we anticipate to address over time, gradually. So over the next few years, we do anticipate developing and implementing through the rulemaking process several MVPs related to the various various MIPS eligible clinician types that currently participate in the program. So there is more to come. And while that's occurring, if you don't have an MVP available, you would continue to participate through the traditional MIPS means, meaning submitting the traditional quality requirements, PI requirements, cost and IA requirements, and satisfying MIPS reporting that way.
Great, thank you so much for that explanation. And we have one more question for you, Sophia. One of our attendees asked, can a physician participate in both traditional MIPS and MVPs?
Yes, that's a great question. We have policies that allow clinicians to, if they have an MVP available and applicable to them, that to register and report an MVP, but then to also continue to report traditional MIPS. What would happen from a scoring hierarchy perspective is that your traditional MIPS score submission would be calculated and scored separately, and your MVP submission would be calculated and scored separately. And we would review both, and the higher of the final score of each submission would be reviewed. The higher of would be considered your final score. So that allows you to continue to participate in traditional MIPS, but also experiment in submitting for the MVPs and seeing this, especially as we continue to implement MVPs, we do want to encourage early adoption. So hopefully this allowance of the scoring hierarchy will encourage those to participate.
Great, thank you so much for that response. And we're going to go ahead and take some more questions that have come in through the Q&A box. This question is regarding the extreme and uncontrollable circumstances exception. And this question just wants to know, the website says the application will open in late spring. Is the application open yet?
Thanks, Emily. No, the application is not open yet, but will be in the next month.
Great, thanks so much. Another question from our Q&A box asks, in a multi-specialty group, including medicine, can a specific specialty like urology, for instance, submit all quality measures for the whole practice?
By the current means of group reporting, that is allowed. However, we do encourage for clinicians to report on measures and submit measures that are directly relevant and attributable to their performance. So again, as we speak about traditional MIPS and the allowances of group reporting in multi-specialty groups, that is allowed. But as we transition to MIPS value pathways, we do encourage clinicians to report data that really reflects the way in which you practice. And so if that means under the MVP program, we have subgroups, we would encourage you to undertake subgroup reporting and report MVPs in a more granular manner that really reflects your practice. We really want to move away from primary care measures being reported on a group that is made up of a large number of specialties.
Great, thanks so much. Another question that has come in through our Q&A box would like a clarification on the difference between hospital-based and facility-based in regards to their MIPS submissions.
So I'll take a stab at it, and anybody else feel free to jump in. But so the difference between hospital-based clinicians and facility-based clinicians, so there are two different types of statuses folks can have in the program. If you are determined to be a hospital-based clinician, you're exempt from promoting interoperability, and facility-based, if you have that distinction, that allows you to use your hospital value-based purchasing program score, so the score that the hospital receives for quality and cost performance categories, it allows you to use those scores as a MIPS clinician as well.
Great, thank you so much for that response. We'll take another question from our Q&A box. And this question is around getting their score. If someone is no longer at their old practice, is there a way for them to retrieve their score?
So your feedback would still be available through, so if you log in through QPP, I believe you should still be able to see whatever information has been given to us, or score information that we've put together for you. All your feedback should be available still.
Great, thank you for that clarification. And we've got a couple of minutes left, so we can take as many questions as time allows. We have one clarification question that's come in, and it's about the hardship exceptions. And it says, are the hardship exceptions still automatic for promoting interoperability and improvement activities for small practices in 2022?
And sorry, Elizabeth, I'm gonna put you on the spot. I believe this is true, but can you repeat that again?
Sure, this question was asking if the hardship exceptions are automatic for promoting interoperability and improvement activities for small practices specifically. But this is also one we may need to respond to in the Q&A.
Yes.
And type in a response.
Yep, we'll get back to you on that one shortly.
Yeah, that this is Stephen. That is accurate. For performance year 22, the automatic reweighting for PI would apply for the small practices as well as the other practice types that have been identified for reweighting of the PI category.
Thank you, Stephen.
Great, thank you for that clarification. And we have time for one more question. And so this question asks, can the small status exception status change throughout the determination periods?
There is reconciliation that's done on the eligibility data, since it is broken into those two different segments, where the final determination would be the actual performance year information. But there is a possibility that you couldn't go from being a small practice to a non-small practice if you were identified in the first segment as being a small practice.
Great, thank you for that clarification. And we are right at time, so that concludes the Q&A portion of this webinar, but we'll turn it over to Katie Moore to conclude the call.
Great, thanks, Emily. Thank you all again so much for hanging in there. I know it was a lot of information, a lot of great questions coming in, so really appreciate your attendance today, and hope you found this webinar informational and answered a lot of your questions. Again, we will have the recording as well as the slides available in the next week or two on our QPP webinar library. And again, if you have any additional questions, our service center is always available as well. But we look forward to talking to you at our next event. Have a great rest of the day. Thanks.